Welcome to today's webinar hosted by the Feminine Rejuvenation Center of Connecticut. I'm Jennifer Kowalczyk, and I'm a physician assistant who does a lot of the feminine rejuvenation consults here in our office. And Katie Warner, who's a RN, is also here with me. And today we're going to talk about why most women start looking into feminine rejuvenation and focus a little bit on Viveve, which is one of our most common FemRejuve procedures that we do, and a couple of frequently asked questions. So most women start looking into feminine rejuvenation for a number of reasons, including vaginal laxity, vaginal dryness, painful intercourse, stress urinary incontinence. So this includes leaking a little bit of urine when you cough, sneeze, jump, and sometimes for enlarged or asymmetric or lax or loose labia minora or a deflated labia majora. So one of the options that can address these things is called Viveve. So Katie's going to talk a little bit more about that.
Viveve is a non-surgical treatment option for stress urinary incontinence, vaginal dryness, vaginal laxity, painful intercourse. It helps to increase overall sensation. It uses radio frequency and cryogen to gently stimulate the tissue to stimulate cell growth and collagen formation. It takes about an hour to an hour and a half in the office. There is virtually no downtime, and it's a very comfortable procedure. Most of my patients describe it as kind of like a menthol feeling, so a little bit of warmth with a little bit of cooling. It's very comfortable. Okay, so frequently asked questions. Who performs the procedure? That would be me. I am a registered nurse and I do all of the Viveve treatments in the office. Next, is it painful? No, it's not painful. It's very comfortable, very tolerable. Most patients describe it as kind of a menthol, icy hot type of feeling. You'll feel some warmth, but you will also feel cooling from the cryogen cooling component. How soon can I be treated after childbirth? We recommend waiting about 6 weeks before doing Viveve, and if you're not breastfeeding. When will the results become noticeable? I always tell patients, to expect to wait about 3 months before you start noticing, either decreased leakage, increased lubrication, increased sensation. How long do results last? Typically about a year. Can I be treated while breastfeeding? No. Can I be treated with an IUD? Yes, you can. Can I be treated if I have had a hysterectomy? Yes, you can. And what is the downtime? There is no downtime, which is the best part.
So just to close the loop on all of the things that we can focus on here at the Feminine Rejuvenation Center, I wanted to touch on 4 other things that people, tend to come in with concerns about. So some of those fall into the category of needing a labiaplasty or a clitoral hood reduction. So that would be when a woman has excess tissue on the labia minora, and sometimes one side is longer than the other. Sometimes both sides are long and go past the labia majora, and this can cause discomfort with exercise, sometimes with sexual intercourse. So surgery really is the best way to address that. We also perform the labial puff, which is to help plump up or give more volume back to the labia majora. Sometimes after weight loss or hormonal changes, and just with natural aging, people notice a change in the labia majora. The O shot is when we use platelet-rich plasma, or PRP, and we inject this into 2 areas in order to help improve sensation and lubrication. And then the last thing is laser hair removal. So we perform with our wonderful new laser a number of areas of laser hair removal. So hopefully you found all of this information helpful, and Katie and I would be happy to answer any specific questions that you have. So just give us a call.